All right, everyone. Welcome to another session of Back to Basics. If you're watching this, you're probably part of our Natural Gut Relief Facebook group, or you may be watching this on our YouTube page, Dr. Viviana Samoa. That's me. My name is Dr. Viviana Samoa. I'm an integrative gastroenterologist in Houston, Texas. My practice focuses on blending the best of both worlds, conventional medicine and integrative functional medicine, or holistic medicine, some people will say. And every Thursday, we make it a point to bring the best of the best in our fields. Those people really helping patients either through research or the one-on-one work they're doing. And I had the lovely opportunity, and you guys will meet her, to meet Jasmine, who worked with me to help her mom. So she actually coached her mom, who was in our program. And it was really just through the lens, I saw her as through the lens of a physician and also the lens of a provider and a nurturer, and saw the impact she made in her mom's life. And I really wanted her to come on and share her work as a health coach, because that's actually what she does with us. So Jasmine, we are so glad to have you here today. I'm really honored that you accepted to join us. And I wanted you to just tell us a little bit about yourself.
Yeah, of course. Well, thank you for having me. I was so excited when you asked me to be on. I'm like, absolutely yes. So a little bit about my background. Um, so I have 7 years of ICU nursing experience under my belt, including the pandemic. I've worked at, I want to say, 6 different hospitals, 4 to 5 different states. I was a travel nurse for 3 of those years. And although I absolutely loved being a bedside ICU nurse, I miss it at times, but I would sit there and think, there's more to this. There's more to this. Where there's some flaws in the healthcare system. And what that looks like is, here's a prescription, here's the Band-Aid, let's cover up your symptoms, good luck. When in reality, all we're doing is ignoring that symptom. We're just pushing it away. Why are we having that symptom in the first place? Which is
Right.
why functional medicine,
Yes.
that's where it comes into play. And so I wanted to, I got burnt out with the pandemic and I wanted to continue nursing because I love my career as a nurse, but I wanted to practice nursing differently. And so that's when I decided to open up my own virtual private practice as a holistic health coach and functional medicine nurse consultant. And so that just launched earlier this year, and it's been incredible. It's been incredible to say.
Just I didn't even know you were a nurse. You are just full of so many skills, so many talents, and I can only imagine you being an amazing nurse just because of our walk together. I mean, with your mom, I know this is your mom, right? And you love her dearly. And but just the patience that you have, the dedication that you have, like kind of being assertive, but allowing her to have that wiggle room so she can make her own decisions and feel like they are hers and she's owning them. Those are some of the things that I think are huge skills and assets for anyone who's supporting someone. And essentially, with health coaching, I think that's what you do. But tell me more, because I want to learn more about this profession. Tell me how health coaching differs to being a dietitian, a nurse, a nutritionist. Tell us more.
Yeah, so health coaching really bridges the gap between the physician and the patient. And so what we do is, of course, when you see your doctor, you have limited time. You have 10, 15 minutes, right? There's no way that, of course, your doctor's saying you got to work out, you got to eat better. There's no way they can really sit there and give you the resources or explain, and this is how you do it. This
Mhm.
is how you do it, right? And so that's where I come into play. And so for me, you know, I know a little bit of everything, a little nutrition, a little bit of labs, a little bit of this. Obviously, we have amazing healthcare professionals that specialize that, and there's a time and place for all of us, right? Um, but essentially what I do is I work a little bit deeper. So for example, Let's say someone really wants to lose weight, but they're just not motivated.
Mhm.
They're not confident, they're not motivated. So I ask deep coaching questions to get to the root of that problem. Well, why are you unmotivated? Let's dig deeper, because you have to find out you have to find out the reason why first before they're ever going to be willing to commit to the gym 3 days a week, or go to the grocery store and shop the perimeter and skip the processed foods in the aisles. So
Mhm.
that's essentially what I do as a health coach. And yeah, it's bridging the gap.
Bridging the gap. And from a provider standpoint, as a physician, very often I wish I had a full hour or 2 hours, right? So the time isn't there. And I would say something else as well is that sometimes we go into our meetings with our patients and we're just spitting out all this medical jargon that you don't even realize the patient really doesn't understand. And just for them to come to the checkout area and say, I have no idea what she said, what did she say? And so having that person to really say, okay, let me break it down, let me explain it to you, this is actually what she means, this is what she's saying, also facilitates the patient's understanding, and then it motivates them to say, okay, now I understand. Because when you don't understand something, you don't understand why you're doing something. So, I mean, understanding the patient's why, and then making sure the patient really understand also the physician's why is kind of how you put everything together, right? So whatever limiting beliefs they may have about themselves, and then whatever limiting beliefs they may have about the provider or medicine or science or whatever in general, you kind of bridge the gap there. You kind of be like, you're kind of like playing on both parts, right? The patients and the providers. And I think that is so important, because I think that person is needed. And then your skill as a nurse kind of puts you right ahead of the game, right? Because you really understand. You understand the terms, you understand you've seen the labs, you can explain to the lab, so that's really, really amazing. What kind of certification is needed to be a great health coach?
So there are many programs out there, but of course, you want to choose a program that is, accredited, that has a good reputation. I did mine through INCA, Integrative Nurse Coach Academy, and
Mm.
they were incredible, amazing. I actually just got back from their nurse coach conference, their symposium, that took place about a month ago, and I'm just sitting there like geeking out, and I'm like, in a room full of other like nurse practitioners, nurses with doctorate degrees, and they're all like on fire about nurse coaching, health
Wow,
coaching.
that's
This is
awesome.
amazing. And so you have to take, your board exam, and it's accredited through American Nurses Holistic Association. And yeah, it's been an incredible journey. And for a moment, I was like, oh my gosh, I'm burnt out. Is this my life forever, working bedside? I don't
Mhm.
think I can do this. And then I stumbled upon this, and I'm like curious, okay. And then I'm just deep into it now. And I'm like, this is amazing.
Now, can anyone be a health coach? Do you have to be a nurse to be a health coach? And can anyone right off the street, be a health coach? I think there's a little gray area there where we see a lot of people, labeling themselves or tagging themselves as health coaches. And I'd like to hear your take on that, because from a patient's perspective, it could be a little bit deceptive in terms of the term health and how much that person really knows about health. And so what are the layers? Tell us a little more about that.
From what I understand, yes, technically anyone can be a health coach.
Yeah.
However, it's very important to get certified, and it's very important to, so what differs a health coach from a nurse coach? I use that, interchangeably, but the nurse coach is essentially the health coach, but they are a nurse. They are still practicing as a nurse. They take a board exam. And
Okay.
so that is very important, because in my studies, we've learned how to, it's a whole step-by-step process on how to talk with clients, and how to, question them deeper, but still respecting their comfort zone. And, you know, Dr. Esimo, you want me to be real? You want to know what was really hard for me in
Mhm.
this program was, as an ICU nurse, I was so used to fixing people. Oh, your
Mhm.
blood pressure's trending down. Let me kick up the levo. Let me kick up,
Right.
you know, oh, the numbers are much better. I feel good. Okay. All right.
Yeah.
Doctor, I need this. Let's do an AVG. I was so used to getting things fixed. This
Yeah.
is this is not the case. What they teach us is you're not here to give advice. You're not
Mhm.
here to tell them what to do. You're
Mhm.
here to guide them, to support them. On the coaching side, you're asking deep questions to get deeper in their thought process. And
Mhm.
what happened
Mhm.
as a child?
Mhm.
Why are you afraid to speak up now? And bring them back to their childhood. What was the earliest event where you spoke up and you immediately were shut down?
Mhm.
Things like that. And
Yeah.
so, and the consulting side, yes, that's a little more of, okay, your vitamin D is 23. You're probably gonna, need to supplement with that,
Yeah.
and things like that. But a lot of that is, so yes, it's one thing to suggest and recommend. But another important thing I want to point out is that I'm very, very, very big on education,
Okay.
extremely big. And that's why I love your page, because
Mhm.
you educate and you want people to take an active role in their health, but they need to understand why. They need to
Yes,
understand why.
absolutely.
So yeah.
So you're kind of deflecting from the question here, because my original question is, can anybody be a health coach, right? And the answer is yes, anyone can be a health coach. So if you're going to recommend what steps, what should people be looking for when they're looking for a good health coach? I heard you say one thing is certification, right? But what else should they be looking for? What would you recommend?
I would say if you're looking for a health coach, and I know the number one thing is if they're actively listening to you.
Okay.
If they are listening to you and what your goals are and what your visions, and not inserting their own goal for you or their own vision, and building that rapport with that health coach, and um what works, there are so many different types of health coaches out there. You just got to find your vibe. Like, who are you vibing with? Who do you resonate with more? Which health coach are you resonating with because of their message? We're all so different. And so I would just find someone who's really actively listening to you, and holds your vision close to their heart.
Okay, okay. So someone who's certified for sure, someone who is actively listening, really understands your vision and holds it close to their heart as well. Those are the important factors. Now, as a medical professional, I still feel it's hard to use the word health coach, like health and coach in the same phrase when someone doesn't have a medical background, right? So
Mm-hmm.
I would feel more trusting to have a health coach who has a nursing background, a dietitian background, because they're very much connected to health. They've been studying health for many, 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 many years, rather than a barista at Starbucks who just decided to be a health coach. So do you think there are differences, or do you think do you really think that the message is truly not so much about the health and medicine part, but really the supportive coaching aspect? And someone could have a skill in that supporting coaching aspect and have no knowledge of healthcare.
Right. That's a really good point. Now that you've said it in that perspective, I would say, if we're talking about a life coach, obviously that's something different. That can be someone who, had an amazing,
Yeah.
incredible, journey, but health specifically, I agree with you. I think that if you have experience in the hospital, in a clinical setting, like you mentioned, nutritionists, things like that, it makes sense because we have that education. We've been there, done that. We have the knowledge, the education, and we've worked with patients, clients. We have firsthand experience of that. So absolutely, yeah.
Yeah. Okay. That makes a lot of sense, which segues into my next question, Jasmine. Like, how do you address dietary and lifestyle factors in your coaching sessions to support gut health, right? Gut health is really big right now. And I have a lot of patients come to me and say, like, I want to know my gut health. I want to know my gut health is good, a very vague term. And I often feel like, well, where do I start? And I feel like if I was actually starting this conversation with a health coach, it may make my part easier because the patient has already gone through that foundational level. So if someone comes to you, one of my patients comes to you, it's like, I want to know what is my gut health status. I want to know my gut health. And I'm having so much of that since that Netflix movie came out about the happy tummy gut. What would you say? How do you incorporate your coaching into that?
So, on top of the full intake form of asking about their stress and sleep and how many times they're pooping a day and what are you eating and things like that, um, I always I always start with stress.
Okay.
Stress. How is your relationship with your kids at home?
Mm.
How is your marriage? How's your work environment? Is it a toxic work environment? Are you
Mhm.
happy there? Do you feel supported as a mother? I ask about that too because, and firsthand, stress causes so many health issues. And yeah, I would start there and how that relates to gut. Well, the brain and the gut are connected. They're BFFs, right? They talk to each other on the highway called the vagus nerve. And so, let's say you're anxious about speaking in front of like 50 people and you get anxiety and nervous. Okay, that's going to travel down to down your highway to your gut, and you're going to get nauseous. You're going to get butterflies. So I would educate on that part of your gut is responsible for 90%, more than 90% of your serotonin, which is your happy hormone. You
Mhm.
know, it's responsible for over 70% of your immune function. So things like that. I would always start with stress, really, because when we're living in that sympathetic state,
Yeah,
yeah.
yeah, that's such a good point. And I don't think that's something we do enough of when patients come to our practice. We usually end with stress, right? But I think the first conversation, and this is wonderful about physicians and practices and nurses and groups, incorporating health coaches into their practice, right, on a day to day, because I think it would elevate patient care so much more and we would get better results. Because it's sometimes hard for me. I don't know. I feel shy to ask, like, how is your work and how's things going at home? Because I've just been so conditioned to saying, how many bowel movements? Are you having pain? Where's the pain? Up, down, low back, da 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 da. But you're right. I think maybe we need to, we absolutely, not maybe, we absolutely need to flip the script and really talk about the patient as a whole first before diving into this tiny minutia of the symptoms that are happening, like what's driving them. So this is so, so important. I could go on forever, but I have
Me
so many
too.
questions. I'm just learning a lot from you, actually, right? Why do you think health coaching has become so popular now? Do you think it's COVID?
I think a part of it is COVID. A part of it is people woke up. I mean, the whole world shut down. And it was scary. It was scary for us too, as healthcare professionals as well. But I think it was a big wake up call for all of us. Like, whoa, our health is really important, y'all. Like that, we lost a lot of family members during COVID and friends, and so I feel that it's important now because I'm turning 30 next month, and let me tell
Okay.
you, my group of friends, we are surrounded by influencers. Okay.
Yes.
This is our culture now. Influencers trying to sell us the latest and greatest supplements or the latest diet trend or
Yes.
whatever it is, right? We're tired of it. We are tired of it because one, we can't afford it. The economy that we live in now, inflation, we can't afford it. But two, it's the same thing over again. We're always buying stuff, but nothing's working. So what's
Fixing any.
really
Yeah.
exactly? And I think we're tired of it. We're tired of it, and we want something more. We want real change, meaningful change, lifelong changes, not a quick fix. We
Yes.
want to live a good quality of life. And I really think that's why.
And that is so true. I mean, this is such an honest conversation because we're kind of evaluating generational health as well, right? The concept of the notion of health has changed dramatically. What my parents in their 70s think of good health, and like they're like, I'm going to do all my tests, I'm going to take my medications, like the doctor said, this, that. Um, and even generations after that, health, I think I mean, I'm in my mid 40s, so I feel like we were kind of the generation of, I still feel like we work a lot, and we're now kind of just realizing that work-life balance is a real thing, and we need to kind of figure out how we're going to make that work, right? Because it is impacting our health and our just the urbanization, the fast-paced urbanization of our society today has really impacted us, right? And then the younger generation, I would say like 30s and younger than 30, I think are really going back to roots a lot more, right? Doing a lot more introspection and looking at, well, how do I heal? Almost like I feel like they are figuring out, how do I empower myself, right? To heal my own body, right? What can I do? Because I believe that I have everything it takes to empower myself. And I think one of the first places they're starting is with education. I need to know about this. And so, I mean, I love that patients come into my practice and they're like, hey, Dr. V, I read about this. Do you think I have that? I could have that because I like 5 of these symptoms and not of these symptoms. And I'm wondering whether I have this. And so they're already coming in very well educated, well versed. And some of them have already worked with health coaches before coming to me. They've worked with dietitians and things before coming to me. So they're doing a lot more like self introspection and seeking answers, rather than relying on the provider or the physician to figure it out, so they're taking a much more active role in their healthcare today, which I think is great.
Yeah, we need that. We need more people to be more involved and not and we of course we trust our nurses and doctors and we trust them, right? But
Yes.
also
Yes.
to challenge them to ask why. Wait, can you explain this? Or why
Yes.
do I need this? Or if they are being put on a prescription medication, say, okay, let's try this, but what's the plan on weaning this off in the future? What's our game plan, right?
Okay. My
Set
long-term. Yeah.
exactly.
Absolutely. So behavioral change is something you deal with a lot, right? I'm sure that's a huge focus of the coaching sessions, like the coaching training, right? Behavioral change, it's something that we as providers struggle with a lot in clinic. We're like, oh, she's never going to stop smoking. When would you recommend that someone actually partner with a health coach, and how should they look for a health coach? Like, where would they even start looking? Where would they begin that process?
Yeah, no, that's a great question. I think to answer your first question on when to look for a health coach, um, it could be there's different type of health coaches, right? And some may have a different like niche or specialty, but essentially it's if you need that extra support, if you need to seek tools and education and suggestion on how to improve your health, depending on what it is. But I think the number one is you have to be willing. That's the thing, is you have to be willing because it's a commitment.
Yeah.
It's an investment in yourself.
Yeah.
And if you are not willing to make those changes or be open-minded or really put in the hard work, you're really not going to get any progress. So that's the first step, is really to see if you're willing. And then, but once you have that commitment, it gets fun. It's not going to be a super rigorous or program or anything like that. It's really fun because you get to explore yourself and learn and educate and take an active role in your health. So yeah, in order to find a health coach, right now through Google, obviously you can search on
Okay.
Google or on Instagram or Facebook. You can search health coach. However, I also recently met a nurse coach who just designed a brand new website that has an abundance of health and nurse coaches on there. Actually, all of these are nurse coaches. So
Okay,
they have to be a nurse to be on this website.
on the
And
site.
there's so many different specialties on there. So I will pull that up and send it to you so that you can share it with your clients. That way, if they want to find a health coach, they can find it through there.
Oh, that's awesome. Oh, that's super helpful because then they
Mhm.
have different specialties.
Yes.
Could you name just, I know you're a gut, you do a lot of gastrointestinal gut related stuff, right? And that's how we
Mhm.
connect. Could you name some other specialties like that other people may be interested in where they may seek the guidance of a health coach?
Yes, there's women's health, women's hormones. That's a
Okay.
big one, especially for the women who are reaching menopause. It's like, what's happening? What do
Yeah.
I do? And so there are health coaches that specialize in that to kind of guide them on this is what's happening to your body right now. This is what your hormones are doing, and this is how you can support yourself during this transition.
Okay.
Um, there are celiac health coaches who specialize in celiac, and that's a big thing. I know you know that's a
Yeah, that's
huge,
huge. Yeah. Yeah.
yeah.
Okay.
So yeah, those are some examples, but you can really find a health coach with anything. You just gotta do a little digging for now.
I love the fact that there's almost specialty because you can't know everything, right? So if you switch to
Right.
another one that I would see a lot of my patients would need help with is um cognitive issues like brain like impairment where they're noticing their memory is going or there's some cognitive impairment all the way to dementia, right? That would be
Mm-hmm.
important. And then maybe even people who want to collaborate and work with people with psychiatric issues, because we're also seeing this connection between health, like nutrition and lifestyle, and even some psychiatric things, psychiatric comorbidities like bipolar and schizophrenia. So someone who's kind of in that field to collaborate with your therapist and maybe your psychiatrist to kind of guide you in terms of what are you eating. I think there's like a huge field. It's almost, I feel like the health coach is like your partner between the physician, everything on social media, everything you may be reading, and truly what you should do for yourself. It's like that filter. They kind of help you filter. If you find the right person, they could really help you filter and remove a lot of the noise and the self-limiting
Mm-hmm.
beliefs and things like that, right? So that's really great. So that's helpful. So you're going to share those resources. I'd
Yes.
love for you to share a success story, right? I mean, it doesn't necessarily mean to be like, oh, they were sick and they got better, but just a success journey, let's say, that your company, Remembering Ancestral Wisdom, Raw Holistic, which is the name
Mm-hmm.
of your company, has
Mm-hmm.
had working with a client.
Yeah, so I think my most recent one, my client was having bloating issues, the common symptoms, bloating, irritability, inflammation, things like that. And so we started her off the golden diet, the elimination diet.
Uh-huh.
Oh my goodness. Within a week, she's like, I already feel so much better.
Wow.
Like just immediately. She even told me, she said, Jasmine, I don't think I want to reintroduce anything. I feel so good. Like, I don't even want to reintroduce anything. And she's like, you know what? Wait, now that you're saying this, the week before my menstrual cycle, yeah, my cramps weren't as bad and I
Mm,
wasn't as irritable. And we're just, I'm help guiding her, and she's like, all these light bulbs are popping up. And
right.
then she even mentioned the KP, the little red rashes. She's like,
Yes.
wait, and this has been smoother. I even
Uh-huh.
noticed like my rash was smoother. So it's just incredible that, she's seeing like immediate results. And even a coworker went up to her and she's like, did you lose weight? Because your face is like, less
Slimmer, less puffy.
puffy.
Yeah.
Yeah. So I mean, just that, and that's just like 3 weeks in. We're in a committed 3-month program, so I'm so excited to see
Oh, that's
what her,
wonderful. Yeah.
yeah.
Yeah. It's so interesting how sometimes it's like the simplest things, right? The doesn't have to be complicated, doesn't have to be a bunch of testing, it doesn't have to be like, go do this, go, it could just be the simplest, right? That ancestral
Mhm.
wisdom that you keep talking
Yeah.
about, right? Just something really simple. Let's start with the basics. Let's remove these things. Let's restore. That's wonderful. That's wonderful. Awesome. So where can everyone find you, Jazz? If they want to work with you, where can they find you?
So I have a couple things
Okay.
on Instagram. That's my main platform just because it's so fun. But on Instagram, it's raw, RAW, period, holistics, HOLISTICS, raw.holistics. And then on Facebook, I have a group on there named Raw Holistic Coaching and Consulting.
Okay.
Raw doesn't have the periods in between, it's just RAW.
Okay.
And then I have a landing page as my website's under construction, so I can send that link to you. Not sure if that'll be a footnote or anything like that. And I'll add that link for the assistance on helping find a nurse coach.
Awesome, awesome. Yes, so we're gonna add all of this in the notes, and post everything. So if there are any updates, let us know. But people, I think the best place for them to find you is really start off on Instagram. You respond really quickly. You guys can
Yes.
see what Jazz does, who she's, kind of, and then go to the Facebook page, perhaps for some additional information. And you already have a landing page, right? So people can use
Yes.
that and schedule a call with you or something like
Yeah.
that and get to know. Perfect, perfect.
Yeah.
Well, this was a wonderful conversation, and thank you so much for your time, and thank you so much for the work that you do. And I'm glad that your journey, sometimes we are not grateful or we are bitter about the way things turned out because you went from nursing and you were kind of burnt out and you went into health coaching. But overall, it just looks like a beautiful blessing.
Oh, yes.
Right?
Blessing,
A
yes.
beautiful blessing for you, for you. All right, Jess, thank you so much for coming
Thank you.
on, and such a pleasure connecting with you, and hope to see you soon.
Yeah, thank you for having me. Thank
You're
you so
welcome.
much.